When the access becomes dysfunctional, there can be difficulties at dialysis, and there can be difficulties with your arm. At dialysis, if the flow is too slow, then you'll have problems with cannulation. The dialysis techs or nurses will not be able to feel the fistula and not be able to stick it easily. You can end up with an infiltration, which means that they take the needle and it goes through the skin and through the vein into the muscle, possibly causing bleeding, pain, and swelling. There also can be difficulties obtaining adequate blood flow. So you could have problems achieving adequate dialysis where the blood is not getting clean enough. There also could be problems with the flow through the dialysis machine, causing clotting of the dialysis. By using the picture that we drew before, we can describe all of the possible problems and how they would affect dialysis. So if the blood coming into the fistula is too slow, so they won't be able to feel it. They won't be able to stick it easily, and you'll have problems at dialysis with trauma and bleeding under the skin. If there's a narrowing within the venous outflow that the blood can't get past, so within the vein itself, pressure will build, and you'll end up with higher pressure in the fistula, causing bleeding when they take the needles out. Another problem that could happen is that you could end up with aneurysms, with bumps along the fistula or even along the graft. These aneurysms, you'll see they called like camel humps at dialysis. This happens when the pressure is increased. So it doesn't need to happen with every fistula. Just because you're on dialysis, it doesn't mean that you need to have these bumps. It just means that you need to make sure that the fistula outflow is open and decompressed and allowed for decreased pressure within the access. If any of the narrowings, whether at the beginning where the blood is coming in or within the outflow where the blood is leaving, if any of those narrowings become too aggressive and shuts down the flow, that's when you end up with a clotted access.